welcome to another episode of Scope. I'm Tracy Pa. Nipa-Kutubu district in Papua New Guinea's Southern Highlands province for the first time held a meeting for members of the District Development Authority on April 23, 2025. The meeting is significant because it brought perspective to local governance. It brought together various stakeholders to discuss development initiatives for the district.
Hundreds of men, women and children converged at the Pimaga government station on April 23, 2025 for the much anticipated Nipa-Kutubu District Development Authority inaugural meeting. Dr. Billy Joseph, the local MP, was coming to visit. Everyone wanted to be there to witness this. LLC presidents and community leaders in the region flocked to Pimaga as well. The atmosphere was filled with excitement as crowds of people waited in anticipation of the outcomes from this meeting. The turnout demonstrated a strong sense of community and the desire for positive change for the people of Nipa-Kutubu. Prior to the meeting, Kutubu Chief Dabura Kamuna called for unity among his people and urged them to join hands with their brothers and sisters in the district in the name of development and prosperity.
Thank you, Long President. Bring it. This was the meeting here. Time to blow me go down finish. Now time blow you blow young blow. Time blow you blow young blow. Now carry this walking stick. Lead him all people the right way. Now the true blow passing.
Kutubu LLG President John Pipikila reiterated that standing in unity allows them as a people to effectively address challenges, leverage on opportunities, and foster a stronger, more resilient community.
MDDA meeting, so you blow together, you must call the Holy Islam meeting. PC meeting to Mamigara over the leader. Now I'm people pulling me, who said Johnny Jawari, Mila pulling, but me have a pulling them, ma through them some long way, but still pulling yet. Mila, you must have together, you may walk. And place for you, Mia. You bless up or ship now, me one man, Baby Bogle, yes, eh? So me like you black arm. You mean like you black arm that you may walk one them, that you may hold him hand one that this black talk politics, place for you, me, but back up. Or same now leader now schoolman or staff or boy blow or boys blow you black or leader man blow you blow or schoolman or staff long and they are respecting me. Now me black come together party one black people hand long. This old man come.
It provided a platform for local leaders, community representatives, and government representatives to have dialogue about pressing issues and development priorities in the district.
What we planning this plan, Canaan, the land of milk and honey. Istablo this plan youth senablo here. Istablo this plan mama senablo here. All papa senablo here. Me black and Kamabem Kutubu, Nipa-Kutubu, Oroma, Plato, me black and Bokim. We have a oil project down there. Why not one the engineer block Kutubu? Beginning the Kutubu can work on this oil project. People outside come, benefit on own land of people. Accountants, engineers, lawyers, doctors, human resource, please. I want you people to invest in human resource. Leaders, take note of this. Me like him review must come up. Time you go inside of NEC meeting, my honorable defense minister, talk him lots of Marabi come on. Go to people like him review.
The main focus of the meeting was infrastructure projects, community services, and strategies for economic development. The sealing of the Kutubu section of the island's highway was priority. Mr. Kila said it would foster a sense of ownership and responsibility in the local government structure.
and one block point below me. No Nipla Lenslong is the same road all the time here. Time this block Marabe Kaman, he took us Kutubu road machine time here. Nipla man Merino sleep to here. One time machine come now. One time I start now. Nipla want to talk to or run the road the second yet. Please, Marabe Muse. But we are Muse. I'm using that here. I'm using that so these last people now come in Savia. Mila give you talking Nipla Stradia, please. This la road Nipla tied up in here. Nipla around the quarter to here.
DDA Chairman Dr. Billy Joseph explained to his people that political stability will drive Kutubu's development agenda. He added that it is essential for attracting investment, fostering economic growth, and implementing effective governance strategies.
Road ceiling will come up, launching will come up here, committee and Mr. Pinis, Miluk Savala committee. As soon as Prime Minister give me exact date, by me announcing date, now committee will get to work preparation for that ceiling launching the project. The next decision on the splitting of electorate will come up along 2032. To make that happen, work by start immediately after 2027 general elections. So you and I have a job to do, and that is to make sure that you may provide him that political muscle which you may got finished.
Dr. Billy also stressed on collaborating with stakeholders to drive sustainability in the region.
Political stability is very, very important. Long making sure that some Trimandla Yumi must come up. Trimandla Yumi long Silim Kutubu access road. I'm not Triman anymore. Because Tami Toto Gosem and me total floor, but long internal discussion long Maple long Hela and Southern Highlands leaders. And as a senior leader belong Social Democratic Party, where me providing stability, then plan the old man run, the changing government. Now me fight strong, now holy Marabe, was a Prime Minister, the government and me sit down. Me talk Silmer Road now. Me talk Silm Road. That is the political muscle and me been missing. Now today you have it.
He then announced a major road sealing project along the Kutubu access roads. Improved road infrastructure will boost economic activities and enhance access to essential goods and services, which align with the broader goals of promoting regional development and improving the quality of life for the people of Nipa-Kutubu.
I want to see something good done, especially for my people of Kutubu and Bosavi. You waited so long, 35 years or so. You wait. People like Chief Deborah Kamana is about time long and finished now. He has to see his road still before his time comes. I must look at him now, I must drive the Seal Road. On the Mogada Papa, only been established in 1990, 1989 and 92. Agreement. Oil agreement come up. Now you've got total long. The UBSA, LBSA, you've got signed him the Kokopo, 2010. How much agreement you may sign him? You need to look at him. Some change must come up the house line.
A couple of local women said their thoughts on this important meeting.
Old man say only member na go. All this like any motorcycle. But young man been kissing slam member so can kissing la meeting long first time long Pimaka station development side and all people man say keke. Lawyer also keke na also go na also can develop place Pimaka. Also so me players struggle na stop na was sak hard we blast making.
So to leaders you can lawyer you look Pimaka station or so on. You look now yet put them like thank you.
The meeting was a success. Locals left Pimaga AP and more informed about the development programs that will be implemented in the district.
Maternal care is fundamental to public health. When mothers are healthy and supported, their children thrive, and so do societies. Maternal care in Papua New Guinea is a critical area of focus due to the country's high maternal and neonatal mortality rates. While there have been significant efforts to improve services, challenges persist. The maternity ward of the Port Moresby General Hospital recently came under scrutiny and subjected to public criticism when a prominent doctor of the hospital took to social media reflecting on a 72-hour shift he had completed, threatening women who had no choice but to receive their medical care on the floor of the maternity ward. The Facebook post garnered traction in the thousands, prompting a response from the management of the Port Moresby General Hospital.
Moresby General Hospital is Papua New Guinea's largest public hospital and serves as the national referral, teaching and research facility. The hospital's obstetrics and gynecology division is a level 6 unit, providing comprehensive services including antenatal care, labor and delivery services, postnatal care and specialized services. Despite its capacity, the hospital faces challenges such as overcrowding, understaffing, and limited resources, which significantly impacts the quality of care provided. These challenges were highlighted recently by Professor Dr. Glenn Moller through a status he posted on Facebook that women were receiving maternal care on the floor of the maternity ward. Dr. Moller's social media post on Monday, 21st April, stated that this humiliating and degrading situation for both staff and patients has been reported to hospital management on many occasions. Dr. Moller is head of obstetrics and gynecology for the University of Papua New Guinea's School of Medicine and Health Sciences and a doctor at the Obstetrics and Gynecology Division. Upon the traction gained by Dr. Moller's social media status across the country, the management of Port Moresby General Hospital responded, first with a repost of an original statement posted to the hospital's official Facebook page dated December 5th, 2023, and later a statement released on Monday, 21st April. The hospital emphasized that the overload challenges have existed for a number of years. Although unfortunate, the dire situation experienced by patients on the floor of the maternity ward is a story shared by a number of other wards at the hospital, including emergency department, outpatient clinics, radiology, and pathology services. Currently, the hospital has about 164 beds in the labor ward, with 24 beds for the labor ward, 4 in the admission area, 96 in postnatal section, and 40 in antenatal area. With this capacity, the hospital frequently faces overcrowding, with more than 7,000 women yearly having to receive their obstetrics and gynecology health care on the floor.
With pregnancy, you can go from normal to dead in a matter of hours. And so a woman can progress from apparently admitting only needing primary care, and a few hours later she needs tertiary care because the placenta has separated inside, or she started to bleed, or the uterus ruptures, or something really bad happens. So she can go from someone apparently admitting with only the need for primary care to someone who is in danger of dying and needing tertiary care. So this is all the stuff that we have to consider when we're planning health services for mothers and babies. And
Dr. Mola and a team of specialists from the Obstetrics and Gynecology Division have presented suggestions relating to the care of women at the maternity ward to the management of the hospital.
Look with your management team, our ideas about how we might cope better with the immediate requirements of dealing with these numbers, with what we've got by reorganizing things and trying to make it better. And then the medium term with something like that specialist perinatal centre that JICA helped us design in 2022, over 14 months of planning. And then in the long term, the Vision 2050 vision to have a specialist women's and children's hospital as a centre of excellence in women's and children's health.
Meanwhile, Dr. Molumi explained further the reasoning behind hospital management's refusal of a possible grant from Japan International Cooperation Agency.
Of course, there was a possible grant. It's not that our money was already ready to be given to us. No, I think that must be made very clear. That the Japanese team sent a technical team to assess, to do a feasibility study for a possibility of supporting us for a maternal and child health facility. Now, when we presented this to the National Department of Health Facilities and Department of Health, and then that matches level 4 or level 5 facility standards. Their proposal was for a level 4 and level 5 also, but it will be a new one, new labor ward. Therefore, when this was presented to the board, it does not meet the policy, which is the National Health Plan for a specialist hospital for Port Moresby with this facility.
With strong disagreement between Dr. Mola, who emphasizes that the hospital would have benefited greatly from this grant if discussions were successful.
And we deliver almost 17,000 mothers in that one labor ward. So at present, that's not capable of looking after the current population that we're serving. Most of these women come because it's just a safe place so that they can come and have their babies. It's not, they don't have a bed, but at least it's a room where there's people, there's nurses and doctors walking around so that they can help them if they have a complication. But not every delivery is straightforward. We have a lot of complications that happen, provided that there's a high burden of mothers delivering there, and we don't have enough capacity to look after all of them. So yeah, I think that's the scenario, and that's what hits us hard as obstetricians and as midwives, because we work for the mothers and the babies. We serve the mothers and the babies. So I think that's where the frustration has been, that we want to see our mothers being cared for.
Furthermore, to address the emergency service demands, the National Capital District Provincial Health Authority has upgraded the 6 Mile Clinic to a 24-hour urban polyclinic, capable of handling Category 3 emergency cases. This initiative helps divert non-critical patients from the Port Moresby General Hospital, reducing overcrowding and wait times during peak periods. Dr. Robin Auger says the NCD-PHA is working diligently to align its services and improve patient care coordination with PMGH.
So that clinic is working well and removing a huge number from turning up here at POMGen outpatient or at the emergency department in the night. And this has been progressing for a while, and we plan to replicate this idea into at least some clinics in Moresby South and Moresby Northeast.
But in regards to maternal health care, PMGH is currently working on plans to install modular delivery rooms and maternity wards at Gerahu Hospital, 6 Mile Clinic, and other clinics identified by NCD-PHA with technical and staffing support from PMGH, with only the complicated cases to be transferred to the Port Moresby General Hospital.
When we come back, Vipers invest in its first academy player with the Hull Kingston Rovers, a program that's sure to improve rugby league development efforts in Papua New Guinea. Young junior Kai Aka Bini, Port Moresby Vipers Rugby League Academy talent, has made a remarkable move to the United Kingdom and now runs alongside other youngsters in the Hull Kingston Rovers Academy. He left PNG late March and has settled well in the UK. He's honing his rugby league and getting an education as well. Junior, who was doing his grade 8 at Yobuna Kauba Primary School in Central Province, was selected before term 1 of school ended. Junior's move to the UK to train under the Rovers Academy marks a significant milestone for Port Moresby Vipers Academy and PNG Rugby League. It is the first, but will not be the last.
Junior Bini Kayaka is adjusting well to life in the United Kingdom. He is on a 2-year contract and trains with new teammates while he attends school at Hymas College. Junior's transition into the British way of life has been smooth, thanks to those who are currently guiding him, both at school, at home, and in the academy. According to Vice Chairman of the Port Moresby Vipers, Tony Sipa, Junior is embracing every new experience in the local Hull Kingston Rovers community. Sipa was instrumental in facilitating Junior's move and has climatized with the local culture, the weather, and general environment. He has also met other Papua New Guineans based in the United Kingdom.
Junior Morat, Miplagoran Lo, UK, Miplagoran, Olakam Kisimiplo Airport, Orlando Hall, Mipla arrived Sunday, Monday will come Kisimipla. So, Lo Side School, making good something, or Maslon, or welcome him, or Kisimipla on side, and only put him in long, of course, meet him all schoolmates, class, teacher, so it was a nice trade, good player. Good person working like member said, and film something you know, not the place and film was important or kind of and all this alright. So in block of I'm Monday, Tuesday in block of club or club of Hamas, especially Jason, line administration, or Hamas Junior. I will put him in block, will start him same day yet and block medical plan, medical plan. Then we'll start put them on the team and start training once more. So you know, some Western time go straight and first day school, second day go start training straight away.
Junior currently resides with Hull Kingston Rovers and PNG Kumul's legend John Okur, who has opened his home to the youngster. Sipa said Okur's support provides a stable environment for Junior so he can develop as a person and, importantly, as an athlete.
So I'm going to pick the club, players will start to go by Sabaton John. So accommodation over the sun, play ready, so he's just going to stay on Piggy Pakistan now. And good luck zone 2 as a member local and one person by giving confidence to Mangi. And 2 is a legend of the club, Al Care. And so and by making extra training or extra motivation role players. So Junior was start to them, and Mouse member lab, so Emerson kind of by guiding them through progress blown lab, John and part of club as well, so make him transition by easy. John too work like member extra training mechanism, so it's good for Junior. But development as a player and as a character too.
Junior's achievement is a historic one for him and his family, but significantly for the Port Moresby Vipers Academy in facilitating training opportunities abroad for upcoming players, beginning with the Hull Kingston Rovers Rugby League Club. Vice Chairman Sipa said this is a breakthrough for the Port Moresby Vipers and a rugby league in the country for the development of junior rugby league.
So it's a big breakthrough. Loside Block Club, Block Vipers, and then Loside Block Hull. Most of people opening. I think inside Papua New Guinea human resources where on the local club or kind of on the club or Australia any club so camping more juniors lumina signing contract and this one named was Super League and same level was NRL so location like an arrangement with them big club was and big owner law certain little vipers people must and low vipers but and low beginning to control those law programs
The partnership between the Port Moresby Vipers and Hull Kingston Rovers is just a beginning, and it's expected to grow in the coming years. SIPA is anticipating sending 2 more academy players to the United Kingdom this year. This will further strengthen ties between the two clubs and open up more opportunities for young Papua New Guinea players. However, sending players abroad requires significant resources. The partnership between the Vipers Academy and Hull Kingston Rovers includes a shared financial responsibility of 50% each in the program. SIPA is urging corporate sponsors to support this program because it has been successful so far.
So those sidelong we play the Vipers, people must play like continuing now. Selling more players go inside. Pull up at the same time. Always something in free. I'm costing money low working. So we play needing some support low. All sponsors where you can come on board supporting plus so that you make a selling plan players go inside lab.
The combination of world-class training facility in one of the top rugby league clubs in the Super League and the opportunity to study at one of the UK's prestigious institutions offers young junior a chance to grow professionally and intellectually. In the coming months, Junior is expected to join the Hull Kingston Rovers under-17 team to play against other academies of the English Super League. This experience should give Junior a chance to put his skills into practice on field and give him more exposure to a different level of competition and rugby culture. Junior Bini Kayaka comes from a mixed parentage of Central and Milne Bay. The 17-year-old comes from Koyari, represented Iobuna Koba Primary School in the NCD Schools Rugby League competition. It was there that he was scouted to join the Vipers Academy. Before embarking on this journey, Junior received words of encouragement and blessings from his schoolmates, his teachers, friends, and most importantly, his mother.
But then meeting him was an opportunity to come into the life again. So let it be. So me have a massive saying. I'm gone now. I'm going to look for him. And tomorrow I'm vlogging and carrying him.
Vice Chairman Tony Sipa thanked the NCD Governor's Office, Money Plus, British High Commission, Hull Kingston Rovers, Hymers College, NCD Schools Rugby League, and corporate sponsors for enabling juniors' progression in junior rugby league development. Junior's journey is a testament to the growing rugby league scene in Papua New Guinea and the commitment of the Port Moresby Vipers Rugby League Club to develop rugby league at school level. This is a start to more great things to come.
Make sure to join the discussions or leave a comment under our stories in today's episode on the TV1 online website and YouTube channel. Until next Sunday, I'm Tracy Pa. See you then.